Now, speaking about African countries and in the African context, why is it extra important, if I can say that we need to focus on antimicrobial resistance? Considering, yes, it's a global threat, but us as a continent, is there a reason why we should be extra keen on it?
Yeah, there's a reason why we should be extra keen. And I go back to the statistics to share.
Yeah.
The global projection in terms of deaths by 2050 is 10 million annually. Half of those deaths will occur in sub-Saharan Africa.
Yeah.
And a similar number also, let me say 90% in sub-Saharan Africa, a similar number also in Asia. So we look at our system. One, we have very weak systems. If it's health systems, they are weak. If it's infrastructure, we also have weak infrastructure. And that also ties in with economic potential at country level. For example, poverty levels are also high in both Asia and sub-Saharan Africa. So for us, we have a double-edged sword. It's not just about the microbes and the inability to treat infections.
Yes.
It's about our capacity to even access these medicines when we need them. Can we afford them? It could be the medicines, one. Number two, it could be the diagnostics. Can I be able to even afford to pay for a simple culture and sensitivity test? Because a lot of the challenges we get aired is the patients cannot be able to pay for the lab diagnostics. That's why people are ending up self-medicating, thinking that it's a cheaper option. But in the long run, it actually becomes more expensive. And I want to give you a simple example. If you have a patient today who's admitted in the intensive care unit, and they have a prescription of a simple reserved category antibiotic like meropenem, what's the cost of meropenem? Extremely expensive. Yeah, it could cost that patient maybe about 100,000 or more.
Yeah.
And remember, that's not the only antibiotic or the only medicine they are on. So by the time this patient gets their final bill on discharge, if their bill is 7 million Kenya shillings or $70,000 US, how many Kenyans can afford to pay that kind of a hospital bill single-handedly? You will sell your piece of land, you will sell your possessions, and you will end up fundraising to be able to clear your bill. So I'm passionate about this because I know what it means for that common wananchi, as we call them here, who cannot be able to afford or access that most effective antibiotic when they need it, where care is not readily available, where our infrastructure is weak. So we need to be particularly careful how we handle our reasonably priced antibiotics, and that is why we need to keep them working for as long as possible.